Good afternoon, and thank you for joining us today. State Health Officer Dr. Harrist will be here, and I've invited Korin Schmidt, Director of our Wyoming Department of Family Services, to speak about some of the work her agency has been doing. But before we get started today, I just wanted to take a moment to recognize that, excuse me one second. I'm sorry, we're still dealing with, in this new age, with technology, and we're learning as we go. But thank you for bearing with us. And before I get started today, I just wanted to take a moment to recognize some of the folks around Wyoming who are really stepping up during this challenging time. These are the local heroes in all corners of the state that are doing things like donating personal protective equipment, printing 3D masks. I have a couple at home for our healthcare workers. And there are others who've organized community Facebook groups to provide support services for those who are unemployed, and also to rally community support for local businesses. There are, I want to recognize some of the work of our infrastructure task force that made sure that truckers moving through the state would be able to get fed at some of our rest areas. And these are the people who embody the spirit of the Wyoming that we know. I have to say, as I greet my wife in the evening and in the morning, I'm always amazed at the amount of people who have contributed to the Wyoming Hunger Initiative. It is astounding. Corporations and people are just stepping up. I do want to say that sadly today we learned of the second COVID-19 related death here in Wyoming. A person right about my age. And I want to extend my deepest condolences to the family and friends of both of the victims that have passed away in recent days. The first was a friend. These deaths are a reminder of why we must take the orders we have in place seriously. I do not want to see anyone have the experience that these two families have had to endure. As of this morning, we have had 287 laboratory-confirmed cases in Wyoming and about 105 probable cases. As of today, there are a total of 19 reported hospitalizations. We do see the number of cases rise, and I want to remind everyone that Wyoming saw COVID-19 arrive late, and if you're following the progress of the disease, we are tracking along with the model. But I will say that the work we have done so far is making a difference. We are not in sync with our neighboring states. They run a range. Colorado, Weld County, for instance, is seeing an enormous surge. They are approaching their surge. Ours comes in a couple of weeks, and South Dakota comes in June. So we are not in sync with our neighboring states, and we won't see necessarily caseloads exactly in the same places. But it means our actions will not be the same either. We are doing what is best for the health of Wyoming people here in the state, and I am in constant contact with neighboring governors to understand their processes as well so that we don't inadvertently cause problems for ourselves or for them. Our Department of Health continues to be in constant contact with other hospitals around the state to monitor capacity, and I am pleased to report that Wyoming hospitals have been very proactive in planning for the possibility of a surge of patients. I also want to point out that hospitals and counties are making concerted efforts to conserve supplies of personal protective equipment, very much in demand across the country. Last week I told you about our particular frustrations in securing that PPE. At the local level, we know there is 3D printing, thinking of here in Laramie County, over in Albany County, and in Sheridan County, where one of the first N95 masks that was donated to me came from. It is exciting to see manufacturing pivot the way it has. Counties are assisting other counties, states are assisting states. This is the American way. This is the Wyoming way. It is critical that we continue to stay the course and adhere to the public health orders that are currently in place. While we continue to see variations in numbers of new cases and how it's regionally allocated, it still remains too early to see if we are near the peak of these illnesses yet. We must all follow the recommendations in place to reduce the likelihood of large clusters of new cases, like that found in South Dakota not only a few days ago. 10% of the country's pork processing was taken out in Sioux Falls, South Dakota. JBS in Greeley is also suffering from this. They will be closed, according to Governor Polis, for about a week, week and a half, maybe 2 weeks. And we don't want to see that sort of situation occur here in Wyoming. I know there have been many questions about what comes next and how we will transition from the current mitigation phase to a relaxation recovery type of phase. The decision to ease these restrictions that we have in place, I will assure you, will be driven by data. And we're already working on trying to ascertain exactly the right data to use, and we'll keep you informed on our progress there. We will also need to have guidance in place for how we move forward while protecting public safety. Our business task force will be looking at how to implement these plans with both short and long-term ideas. I think it's important for the people of Wyoming to understand that our economy is not the same as it was in February. It is a changed economy, and we will be living with this virus for some time to come. We will be taking public input on those proposals, and we look forward to having those available during the coming week. I will say, in my conversations with companies large and small around the state, I have to say it is very encouraging to see how businesses are adapting and continuing to stay in place. Just yesterday I was talking to the Wyoming, a bentonite producer, and they are continuing to run at full capacity. Biggest challenge we have is that unfortunately, because of transportation and other aspects of the Saudi and Russian challenge on oil prices, we've seen prices for oil drop and gas drop to unprecedented lows, making it very difficult for Wyoming to continue to have production. Looking ahead, I have been approached by governors in neighboring states to discuss how, as a region, we will begin to look at how we change our orders. Our health department is examining metrics that would indicate our efforts are effective at flattening the curve and slowing the spread of the virus. I need to stress two things strongly. One is that if we ease up and fail to adhere to the guidance currently in place, if we think that this will turn off like a switch, we may not be ready to relax any restrictions. As I've said from the very beginning, and taken a tremendous amount of heat, I believe in the people of Wyoming. I believe in common sense. And I believe that the people of Wyoming, through continued actions and common sense, are willing and ready to determine what sort of future we have. Number two, and I want to be clear on this, if anyone thinks that simply easing restrictions currently placed will lead to an immediate return to normal, they need to think again. It is important to be honest about the economic challenges that Wyoming will continue to face in both the short and long term. This will be a slow recovery. And I have continually talked with the legislature, gotten their very good ideas on ways that we can address issues in both the short, the medium, and the long term. I want to push back against the notion that we need to open Wyoming. because Wyoming has been open. We have, to be sure, had some restrictions in place on certain businesses, and those have been hard. But we have had many industries that have continued to operate through this pandemic, and we've made a number of accommodations to help them to continue with their economic activities. Anybody can look at the national economy and understand that there are factors outside of Wyoming that will continue to influence our economy. Tourism, we anticipate, will take an enormous hit. We also know, and we've spoken about, what will happen to our mineral sectors. I'm particularly thoughtful about some of our industries in the southwest part of the state, Trona and others, that are also dealing with activities by China to bolster their domestic economy. As the director of the Centers for Disease Control indicated a few days ago, any plan to scale back orders we have put in place over the last month will require aggressive contact tracing. You may have heard this term frequently used of late. Contact tracing is the process of locating and reaching out to those close contacts of someone who tests positive for COVID-19. And I'm happy to report that our epidemiologists at the Department of Health have been doing this all along and would continue to do so during our recovery phases. And I want to ask Dr. Harrist to speak a little bit about this at this time. Thank you. Dr. Harrist.
Thank you, Governor Gordon. As many of you likely know, today we have worked with Teton County to extend their countywide order limiting gatherings to only individuals within the same household through April 30th. This timing matches the 3 statewide orders currently in place. I also appreciate the opportunity to provide some information on contact tracing. Wyoming has been contact tracing since the beginning of the COVID-19 outbreak. It's also a public health technique that we have long used for other diseases as well. Contact tracing involves following up with our laboratory confirmed cases, usually by phone. We ask them a series of questions about their illness, their situation, and we ask them to identify their close contacts. We define close contacts as people who live in the same household, as well as people who have been within 6 feet of persons with COVID-19 for at least 10 minutes. On average, it takes about 2 to 3 hours to interview a case, to notify high-risk contacts, and to issue isolation and quarantine orders. If a close contact of a lab-confirmed case has symptoms consistent with COVID-19, we treat them as a probable case. We follow the same contact tracing process for probable cases. We offer advice to these individuals and use quarantine and isolation orders to help protect communities from further spread. Within the Wyoming Department of Health, we have typically about 5 staff members who do this type of work on a regular basis. We have reassigned other staff members to help during the COVID-19 outbreak. County health partners are also very involved with a contact tracing effort, and that's something we really appreciate. They have done great work and have been very helpful. Due to the nature of this disease, nothing is foolproof, but we believe our contact tracing efforts have been very helpful in limiting and slowing the spread in our state. Contact tracing can help us identify localized outbreaks and, in general, to get an idea of what is going on with the disease in our communities. Contact tracing will also be important to help contain the disease as we move forward in future phases of our recovery to help identify and contain localized outbreaks. The team from CDC arrived yesterday and includes 4 epidemiologists and 1 laboratorian. The team will be focusing on prevention and management of COVID-19 within long-term care facilities and other communal settings, as well as data management and analysis. As we consider our steps moving forward in terms of orders and other public health interventions, we will continue to use data to inform our decisions. There is not one single data point that we can rely on, but rather we need to consider the entire picture. We'll consider what the data are telling us about the outbreak itself, as well as the impacts on and capacity of the healthcare system. Another important factor will be the impacts on the most vulnerable residents of our communities, including older individuals and those living in long-term care facilities. Going forward, we need to continue to be able to protect these individuals from getting sick with COVID-19. It's important to remember that it takes more than a couple days worth of data to be able to draw conclusions about what is happening with the outbreak in Wyoming. We need to see sustained trends to make sure that we're basing decisions on reliable information. I mentioned impacts on healthcare as a primary consideration. We can tell you that to date, there have been 43 total hospitalizations of laboratory-confirmed cases, and that there are approximately 19 hospitalized now. Some of those people have been in the hospital for prolonged periods of time. As critical partners, we want to stress how important it is for Wyoming hospitals to report to the Department of Health the daily data we are requesting. Your hospitals are being asked to report COVID-19 admissions daily and other information such as bed capacity, ICU capacity, and ventilator capacity. This information is crucial for our planning and decision-making and helps us understand the true stresses on our healthcare system. We know that hospitals are being asked to report a lot of data to a lot of places, and we are working on making reporting more efficient for them. Finally, I know that this has been very difficult for families and for family businesses. I understand and sympathize. However, I've also spoken with physicians over the last several days regarding the 2 people we've lost because of this virus in Wyoming. And it brings home to me why these difficult decisions and the significant changes that people have made in their lives to protect their communities are so important. Thank you, Governor Gordon.
Thank you, Dr. Harrist, and thank you for your team's continued commitment. It's an honor to work with you, so thanks. I also want to introduce you to the Director of Wyoming Department of Family Services, Korin Schmidt. Over the last few weeks, you've had an opportunity to meet some of the rock stars of this administration. Korin is one of those rock stars, and we have not had a chance to really talk about what's happening at home, how we're taking care of children, what we're doing with a number of those issues. So Director Schmidt, please.
Thank you, Governor, very much. My name is Korin Schmidt, and I'm a member of an amazing Department of Family Services staff. I want to thank my DFS family, who in just a few days completely revamped their work to best serve the communities safely but effectively. They have been innovative, supportive, and accepting of the fact that we are a safety net organization, and in crisis times like these, we absolutely need to step up for our children, our families, and our vulnerable adults. I'm very proud to work with you and for you. I'd like to share with you today what Wyoming is doing to address and support the human service needs as we respond to the current crisis and start looking toward the future. Early on, the governor, the state health officer, and our department recognized the importance of childcare as an integral part of the workforce infrastructure. When the governor first announced the need to close numerous businesses for public health reasons, the order ensured child care would still be available for children of essential personnel. To connect families with child care facilities who are open and accepting children, we created a directory on our website, dfs.wyo.org, for an easy reference. We keep the website current as possible. We are asking providers to work closely with their local public health officials to ensure the safety of their children and of the staff, and to refer often to the CDC guidance, which is also located on our website. Staffing child care centers has always been a struggle. We offer a clearinghouse where child care providers can find temporary staff who meet the current child care staffing requirements. To date, over 60 child care staff have been identified as temporary workers. If you're a child care worker interested in providing substitute care, please contact our state office at 307-777-7290. We also have a set of guidelines on our website for businesses like healthcare facilities who find themselves in a child care shortage situation and can have guidance available to you to set up temporary child care centers. Finally, the CARES Act awarded $4.1 in federal money to my department for supportive child care providers. Those funds will be directed to child care providers through a combination of subsidy and grant applications, subsidy payments and grant applications. The federal government is also supporting many of our other agency and programs, which includes expanding food funds and eliminating some work requirements for recipients of SNAP, formerly food stamps, extending the crisis season for energy assistance for one-time emergencies like a broken furnace, and if funding allows, we may be able to extend payment assistance for energy bills. Federal government is also allowing us to temporarily waive some of the rules and regulations to make it easier for state to support the continued work of many of our local providers and nonprofit organizations. It's also increasing the amount of federal funds available for children in foster care, and it's increasing funding and spending flexibility for community organizations that help our homeless and help our low-income families. I grew up in Wyoming, living all over the state, and there's one thing I know to be true. We take care of each other. We know each other, and we know when our neighbors need a little extra help. During this time, my department is working diligently to keep families safe at home. And as we move toward recovery, we want to be prepared to offer opportunities for success. Our best work is done when we can support you at a local level when you need it. April is also the month we bring awareness to preventing child abuse. In the context of COVID, this is taking on a much broader meaning. The child welfare system involving law enforcement, attorneys, advocates for children and families, and our agency continue to do our part for children to keep children and families safe at home. But the real prevention work is happening right now in your community. All of our families are struggling with situations that are testing our ability to maintain a positive environment for our children and older residents. How can you help? You can support financially the many nonprofit organizations in your community who are reaching out to their clients every day. Now that schools are regularly communicating with students, they will need the help of local human service agencies now more than ever. You can volunteer with any of these organizations, like the Senior Citizen Centers, to safely deliver food to many who are unable to go grocery shopping on their own. You can support the faith community, who in many areas are taking the lead in organizing local support efforts. Most important, you can connect with your neighbors from afar. Leave them a note, ask how they're doing, and ask if they need anything. And if they do need something, like food or medical help or a timeout from their kids, get them contact information for a local food bank or a community mental health center or a youth crisis shelter or a local DFS office. The First Lady's Hunger Initiative has done and continues to do an amazing job highlighting local efforts to connect people and food resources, and we're very proud to help them with their efforts. I encourage you to refer to their website, nohungeryo.org, for more information. A healthy community is the best prevention intervention for children. It opens the doors for social connections to support parents and helps children develop social and emotional coping skills. We all find ourselves facing situations we never imagined, but please know there's support and assistance in every community. If you want to reach out, we have offices in every county. We are practicing social distancing by providing convenient drop boxes and encouraging you to call the office first to make arrangements. But we are open to serve you. Thank you again, Governor, for the recognition of the human side of this pandemic. I appreciate your faith in Wyoming's communities and confidence that we will all step up to do right for our neighbors.
Thank you, Koren, your department, and the courageous people that work there every day are an amazing example of humanity and of courage. And I will mention just one thing about that in a moment. I do have a couple things before I wrap up. Korin just told you about a lot of the things that her department is doing. But I think it's a great transition to really talk about the fact that the issues that were important to Wyoming citizens in February, in January, in December, and November of last year, those issues are still important. In COVID, it is true, like that iceberg that hit the Titanic this week, COVID has put a big obstacle in our path and causing some real challenges. So I really want to recognize your group for going above and beyond to really meet those challenges. And in the last couple of weeks, you've heard from Director of Workforce Services, you've heard from the head of the Wyoming Business Council, you've heard from the auditor about many of the things we're doing, and the state continues to run. I'm excited today to say that over the next few days, one of our task forces will be winding down. It's done its job. The Transportation Infrastructure Workforce Task Force will be winding down, that doesn't mean we're going to stop working on those issues. It just means the immediacy of that situation has been addressed, and you know, I will say that other task forces will continue to do their work, but these are not intended to be permanent task forces. One of the priorities of the Financial Task Force was ensuring that Wyoming small businesses have access to the resources that were made available through the CARES Act, including the Paycheck Protection Program. And I want to tell you that this program was designed to provide direct incentive for small businesses to keep their workers on a payroll. Through Monday, the Small Business Association, Wyoming banks, and with the assistance of this task force, has approved over 5,730, that is 5,730 loans totaling more than $706 million to Wyoming small businesses and nonprofits. Really astounding numbers, 5,730 loans totaling $706 million, more than. And these dollars will in turn be used by these businesses and nonprofits to keep their employees working through this crisis. I also want to turn just briefly to concerns I've heard over the last couple of weeks about as spring comes, how many out-of-state folks are coming to enjoy our wonderful resources, and the concerns that might bring. So in consultation with the Wyoming Game and Fish Department, I mentioned last week that we'd be talking about fishing licenses. Today, the Game and Fish suspended the sale of non-resident daily and 5-day fishing licenses, and that is effective immediately. This suspension is due to the need to ensure individuals coming into Wyoming for a non-work related purpose comply with my directive requiring a 14-day quarantine during the COVID-19 pandemic. This isn't unique to our state. This morning I was talking to Governor Polis of Colorado, and he has suspended licenses for turkey hunting in Colorado. Kansas has done a similar thing. We can also continue to review our options with regard to action that we can take to support renters unable to make rent payments due to the fiscal situation we find ourselves in. I've been talking with the Wyoming Community Development Association, Authority, to find if there are ways that we can assist in this. Some states have taken the approach of suspending mortgage payments. Federal government, indeed, has done that, but in a way that is inconsistent across all the programs. Rural development, veterans are in a different category than some of the Fannie Mae and Ginnie Mae programs. And so we're looking to ways that we can bolster WCDA to see if we can help not only with renters and their requirements and mortgage payments, but also with the landlords, because this challenge is really across our entire economy. And lastly, I want to say that as we relax these orders, as we look at the ways we can do that, we are going to reemerge into a new reality, a new type of economy. Social distancing isn't going to go away. We need to start thinking about what school is going to look like next year, how we're going to make sure that our kids are safe. I've been talking with the judicial part of our government to make sure that we understand what trials are going to look like. There are going to be a lot of new realities that we're going to have to face. And so I think it's important that the people of Wyoming start to come up with good ideas. Just today I was talking with my barber about what are the things that we can do to make sure that our barbers and cosmetologists can make sure that they're safe. So we are all talking about what our new reality is going to look like. And I have to say that even though we have been devastatingly hit in our energy sector, in our tourism sector, we as Wyoming citizens, as Korin put it very well, we are a unique people. We are a strong people. And we will move forward with courage, conviction, and we will make a better Wyoming. And with that, I want to stand for some questions from the media, and I have one that was submitted prior to this from Andrew Graham of WyoFile. And it says, is the governor making any special effort through the congressional delegation, for example, to push for direct financial assistance from the federal government that would be less restrictive than the COVID-19 CARES funding and could replace lost revenue? Andrew, yes. The CARES Act comes with, and we haven't yet seen the full guidance on it, but it comes with some caveats about how it can be used and when it has to be used. And as we get a better understanding of that, of course, we'll figure out how it can benefit the people of Wyoming. But specifically, it cannot be used to replace lost revenue. And I would challenge almost anybody in Wyoming to say that lost revenue isn't a condition of COVID-19. We saw it hit here in March, and since that time, you know, I quoted the number of rig counts, 27 to 7 on the way to 0. So that was particularly disappointing as that bill came out. Still an amazing bill in many ways, but we are looking for ways that we can have an additional stimulus to help tide us over, to help rebuild our economy, and to make sure that we can go forward. And from Angus Thurmer, I think there's a question for Dr. Harrist. Angus, I'm taking umbrage at this because you always ask Dr. Harrist questions. Yes, Dr. Harrist. Oh, the question is, will the CDC be working in long-term care facilities or recommending steps Wyoming should take with regard to them? Does the state have a plan to fight COVID-19 in long-term care facilities or other close-quarter living facilities?
Thank you. So, you know, I'll note that our long-term care facilities acted early to implement, you know, the guidelines that have been recommended by the Centers for Medicare and Medicaid Services and the Centers for Disease Control, plans such as visitor restriction, cohorting patients, identifying ill patients, and testing early. So certainly they have plans and have implemented them. But that is one of the, you know, one of the things that we'd like CDC to provide some technical assistance and guidance on. There are some nuances and challenges to outbreaks in long-term care facilities, such as testing strategies when you have limited testing resources, being able to cohort patients and staff when you may have limited space or limited staffing to be able to do that. And so I think that they can provide some assistance both with the facilities that have experienced some cases and some outbreaks, but also facilities that haven't yet, and there are many of them, in making more specific plans for what would happen if they were to identify a case.
So now if we go to the phones, we'll hope, I think last week we had some success, but I'll still try to remember to repeat the question.
This is Mike Kosmero with the Jackson Hole News and Guide. Can you guys hear me just fine?
Yes, Mike, yes, to your question.
I'm wondering if Dr. Harrist can speak to the contact tracing analysis in a little more depth. We've had 287 positive cases. Of those, how many have we run like a thorough analysis on? And then also, like, what's the state's capacity to deal with it? She said, I think, or you said that we have 5 employees working on that effort. Or just looking for some numbers in detail.
I'm sorry, could you repeat, or did you hear the second part of that question? Would you speak up a little bit and repeat the second part of the question? I think the first part was a little bit more detail on contact tracing, in particular, how many of the 287 cases we have detailed data on. And then the second part?
I'm wondering about the state capacity. So simultaneously, how many positive cases could you guys be pursuing contact tracing on with your current staffing working on that?
Okay, thank you. The second part was capacity and how many cases we could contact trace at one time. Yeah, so of the 287 cases, I'm not sure how many were reported today, but we have contacted all of them up to this point and will contact all of them, as well as have contacted their close contacts, and if any one of those close contacts is sick, their close contacts. So we really have been able to contact, interview, and issue orders for everybody involved thus far. Again, we usually have about 5 epidemiologists whose job it is to do this for infectious diseases, as they're on a daily basis. We've brought in multiple others from other epidemiology areas, chronic maternal child health disease epidemiology, as well as members of the public health division who aren't epidemiologists to assist with these activities. I can't give you a number for how many we could do per day. There's still workforce within the public health division and in the Department of Health that we could pull in to help. I really think that contact tracing is extremely important. It's one of our most powerful tools, along with the social distancing tools, and I want to continue it for as long as possible, and we'll make efforts to do that.
Thank you.
Thanks. Next question.
Hello, this is Isabella from the Wyoming Tribune Eagle. This is probably a question for Dr. Harris. So I was just wondering, do you think there are more than 2 deaths from COVID-19 that are the deaths you have confirmed, and have coroners instructed back those potential and confirmed COVID-19 deaths?
So the first part of the question was, do I think we've had more than 2 deaths than the 2 deaths that we have confirmed? I do think that it's possible. We do know that testing is limited, and just like with other patients, there may not be potentially testing available for everybody. However, we do know that we've given some instructions and guidance for coroners, and that coroners and as well as other attending physicians have sent pre-mortem or post-mortem samples for testing, and the other tests that have been sent have been negative. And it's also possible that even if testing is not available, if a provider strongly suspects coronavirus or COVID-19 as the cause of death, based on epidemiologic or clinical factors, that can be listed on the death certificate as well and would be counted as well. We're working closely with our vital statistics department to be able to identify any deaths that might be related to COVID-19.
Thank you. Next question.
Governor Barbara Ann from Bighorn County Newspapers. My question is for you.
Yes, thank you, Barbara Ann.
Does the state and or county public health offices and officers have any authority over people who know they've had contact with a confirmed positive case and are not self-quarantining? And also, there are some people that have received a letter that are not self-quarantining, and some people that have had contact with a positive case but did not receive a letter because there was not truthfulness when they were interviewed. So if they're out there and they know they've had it or they've been quarantined, is there any way that they can be held accountable if they're not self-quarantining?
Well, thank you, Barbara Ann, and I might defer part of that to Dr. Harrist. I will tell you, if they're in a violation of a health order, they are in violation of a health order, and there is a fine that is attached to that. My hope is that, you know, I'm not accustomed to playing Russian roulette. It doesn't seem to work out in all cases. And so if people are out there, you know, with the idea that this won't happen to me, I think they should probably think again and not endanger either family or others. You know, there was a time when people said this would only affect, I think the hashtag was something fairly, I think it was called Boomer Remover. And the laughter was that it only affected older people, and yet you see people in their 20s who are dying, you see people in their 30s who are dying, you see people in their 40s who are dying, and so it is a serious disease. People should take these seriously. They should be truthful, and that is what I think people in Wyoming should do. But Dr. Harrist, is there anything to add to that?
Thank you, Governor, and I will repeat something that you said, that the orders that we're issuing are legally enforceable orders and do have a fine or a charge associated with them. I will say that, you know, the vast majority of people that we've called and talked to, you know, understand the seriousness of COVID-19 and are really doing their best to follow the orders that we've given them. And we know that it's not easy to isolate and quarantine yourself for prolonged periods of time. But we also know that there are cases out there that we haven't, you know, laboratory confirmed, that aren't being tested. And so that's why, in conjunction, you know, with the contact tracing efforts, which are very important, equally important are the social distancing measures, the staying 6 feet apart, the wearing face coverings when you're in public situations where it's difficult to stay 6 feet apart from others, why those things are both important to be doing at the same time.
And thank you for that, Barbara Ann. Next question.
Hi, Governor Gordon. Go ahead. This is Tom Coulter with the Tribune Eagle. I was just reaching out. So I wanted to circle back to some of what you were talking about with evictions and foreclosures. So first I wanted to ask, is the state still seriously considering this statewide ban? And secondly, what would you say to any local municipalities that might be perhaps considering a ban, as we've seen in some other cities around the country?
I'm not aware of any cities that are looking at that. I can tell you, and I say this, you know, I've said this really from the start, I recognize the issues with evictions, and I recognize the issues with mortgage payments and foreclosures and all of that. We've been very concerned about that from the start. That I don't have with me today, I have a letter from a gentleman, a veteran over in Evanston, who explains that, you know, the burden this is putting on him as a landlord when he was trying to make sure that you know, he had accommodations and his, he could make sure that his well-being was also protected. And so, you know, our remedy here is really designed at shoring up the entire system, making sure that people that are facing evictions or foreclosures are somehow given relief. And at the same time, we're not shifting that burden to landlords. It's important that our economy stand up in full. And so we are looking at ways that we might be able to purpose perhaps some funding to help with shortfalls in that kind of a situation.
Awesome. Thank you.
Thank you.
Governor Gordon, this is Seth of the Star Tribune. Can you hear me?
Yes, thank you.
Awesome, thanks. So the orders you extended expire in a couple of weeks. Have you started having any conversations or thoughts about extending them further?
As I say, we're really transitioning to a stabilization mode. We're looking at what data can be used to inform whether orders need to be extended, modified, loosened, made more practical in certain areas. We're really looking at how that landscape is going to sort of roll out after May 1st. And I will say, we're looking at that in consultation with our neighboring states, so that there are similar approaches that we're all taking as we do that, and we will be diligently pursuing that over the next couple of weeks.
Great, thanks.
Thank you. Next question.
Governor Gordon, this is Matthew Copeland from WildFile. I wonder if you could sketch for us the broad brushstrokes of the state's plan to return to normalcy. Dr. Harris made mention of future phases of recovery. You've alluded to a phased approach. I wonder if you can give us a sense of what those phases are, what the steps or milestones we need to accomplish to move into and through them would be.
Well, let me state first and foremost that since there is no cure and since we don't have a vaccine, it's a little bit unclear how quickly we can return to quote normalcy. On the other hand, we have to carry on with our lives. We have to, as the military would say, get our heads in the game, be able to prosecute our affairs as we would like, and that will require some changes in behavior, and we've all pretty much adapted to that. That's what's been good about our approach, I believe, is that we have seen people that have been much more conscious about social distancing, about not making too many trips to the store, not doing that in groups, not gathering in large groups. And of course, there are some places where people are being, I don't know, unfortunately, not following those guidances. But what you're seeing is that people are beginning to respond. There's much less of that activity, and I think those it's a little bit hard to say whether those are really being depicted in the data with infections, but they are being depicted in the data that we are tracking on people's movements, et cetera, et cetera. Those should come to bear. But as we look at what this is, this stabilization phase, transition phase, we can look to a couple of things. What is the adequacy of our testing? How well can we how well can we track where those contacts are? What are the things that we can look to in terms of hospitalization capacity, personal protective equipment? These things are in short supply now. What is a good buffer to anticipate? What is the rate of infection? How many of those infections are going to be community spread related? How many of those are going to be directed, that we can actually say where that infection came from? Those are the kinds of things that we're looking at, and we'll hash those out. Dr. Harrist is, as we mentioned, is very much in this mix as we talk about how do we measure these things, how can we make sure that we aren't sort of steaming full speed into another surge or a resurgence, And we have a lot to learn about this disease as well. So it's a very dynamic situation, but I think it's important that the people of Wyoming understand that we are looking at ways to be able to ease with public safety very much in mind, and with the proper behaviors very much supported going forward. So thank you for that question.
Governor,
thank you.
Ryan Robertson with Wyoming News Now. You've mentioned a couple times about trying to secure PPE. A couple weeks ago, you had mentioned that the FEMA had redirected some of the state's orders. Just wanted you to expand a little bit about that. Has the state been able to secure some PPE orders, or are they still being redirected?
We've been able to secure a few more orders. We continue to aggressively look at how we can acquire more. You know, the lucky thing for us is because people have been doing the right thing, we haven't seen quite the surge yet that we might have seen, and so this has given us a little more time. That's really important. It's a congrats to the people of Wyoming for doing the right thing, which I knew they would. But what it is allowing us is more opportunity to look at different routes to be able to acquire more of these supplies on PPE. Right now, one of the things that we're in dire need of is testing supplies. And so we're really doing our best to try to find any route that we can secure more testing supplies. And these are issues that are not unique to Wyoming. They're happening in Utah. They're happening in Idaho and elsewhere, South Dakota. So I do want to give a shout out to the University of Wyoming and the Wyoming Health Department for being able to make some of the media that's so important for these testing supplies. And it's exciting to see that we're cooperating across state lines to try to figure out ways that we can procure more of these tests.
Hi, Governor. Jim O'Reilly, Bigfoot 99 Radio. Two unrelated questions. One has to do with the data point of ICU admissions. Do we have a count of how many ICU admissions there have been and a total number of ICU days in hospitals? And also, I suppose that question is for Dr. Harris. The second question is to you, Governor. Can you elaborate more on that LSO that was sent to the legislature last week and your news release earlier today about impacts to state agencies? What are you expecting will have to happen to state agencies over the next year?
Thank you, Jim. Go ahead. I'm sorry.
No, I think you've got the gist of the question.
Okay. Yeah, thanks, Jim. So as I've mentioned a couple of times, because the economic data that Wyoming uses to analyze its consensus revenue estimating group, the so-called Craig report, because that lags by easily a month, the April Craig report really has to be looked at as an antique. We are probably looking at, it's pretty obvious that we are seeing a disastrous decline in economic activity, particularly in the oil patch, but obviously Trona as well has been hit, and coal continues to slide. Tourism obviously has been heavily hit as well. And those data are going to start to express themselves this month. I'm anticipating we have an emergency Craig meeting in May, and that may occasion the opportunity for the legislature to come back and look at what we need to do to adjust our budgets accordingly. I wanted to get a head start on that. I wanted to reach out, and I can't tell you how disappointed I am in this. That's really not even the right word. Sad is a much more appropriate word, because there's so much that our state does for the people of Wyoming that is critical. You heard from Korin Schmidt just a moment ago about the services that that her department delivers and the support that they offer families and individuals. But it is unlikely that our budget picture is going to be able to support the program levels that we've had in the past, and so it seems a good time for directors to start looking around for potential reductions that we'll have to make. We have put a hiring freeze in place, a number of other things along the lines of what Governor Meade had to do back in 2016 when we saw another pretty calamitous drop in the state's revenues. I'm horribly sad to relay that because I think our state has done a very good job of trimming and aligning and becoming much more efficient. But circumstances are what they are, and Wyoming is no different than the industries that support it and work in it. And when we all feel that hit, we've all got to look at what we do about it. And as for the first question that you had, Jim, I'm going to let Dr. Harrist speak to it. We do know those numbers. So,
thank you, sir.
Thank you. And I don't have those numbers on me, but I agree with you that, or I guess I'm assuming I agree with you that, ICU admissions, days in the ICU, patients needing mechanical ventilation are important measures to both understand the severity of the outbreak in Wyoming, but also to understand our hospital capacity. We realize that there are some challenges in collecting this data. Providers calling us every day or multiple times a day to let us know the status of their patient seems like a heavy reporting burden on them when they have important patient care activities to do. But we are asking hospitals, as a whole to report those types of data to us so that we can have them and track them going forward to understand, both things, as I said before, the severity of the outbreak here as well as the hospital occupancy and capacity and how much extra capacity that we have.
Thanks, Jim. And I have a question here from Rachel Sauer of K2 News. Did I pronounce that name correctly? I was an old soccer referee and I always butchered names. Rachel, are you on? Oh, she is not on. So her question was, a coronavirus model cited by the White House predicts that the virus might start to, quote, peter out, end quote, in May. Do you see Wyoming following a similar trend? And Dr. Harrist, I think probably you're the right person to answer that.
Thanks for that question. We know that there are many different models out there. They're changing day by day. They each give slightly different predictions, or sometimes have some bigger differences based on the assumptions and the data that they used. We do think those types of models are useful to help us prepare. Both from an epidemiologic and hospital capacity standpoint, but I think, I don't want to say that we can guarantee that the outbreak will peak or end at any given time. I think it's important to keep an eye on our Wyoming data that we have that's on our website to truly understand what's happening in Wyoming. Use the models for what we can in preparing, but not put too much stake on them in trying to predict the future.
And thank you for that question. And Dr. Hess, I just want to say, we had a little bit of a discussion along those lines last Friday morning when we had a conversation with Dr. Fauci. So, 2 more questions.
Governor Gordon, it's Barbara Ann again. Nationally, there have been stories about drive-in church services where people are staying in their vehicles, parking 6 feet apart. And many of those have had to shut down despite complaints that there's crowds of people going to stores and not maintaining social distancing. The argument is that the drive-in services are safer yet have been banned. Has the Wyoming COVID-19 task force discussed drive-in services in Wyoming? And if so, any recommendations on if they should happen or not?
I'll let Dr. Harris speak to that.
Sure, and I certainly can't speak for every instance, but there was a lot of discussion about drive-in services last week in preparation for Easter. Some counties, had received plans to have those and had approved those, based on what you were saying, that if people are really staying within their households and in their cars, that would be a safe way to conduct church services without having people interact with each other. So I do believe that happened in Wyoming over the weekend.
And Barbara Ann, I want to say that, the intent of our orders has been to protect safety and health. And we've been trying to be flexible in doing that as long as people don't endanger others. And so I think people have been very respectful of those orders and tried to adhere to those considerations. So I want to thank them for bringing those up. One more question.
Hey, this is Andrew with Wildfile.
Yes, Andrew.
I'll follow up on that question from Jim about the press release that you put out talking about the direction you gave your agency to start looking for savings. So many of those government agencies are probably, on the front line of the response to this pandemic in so many different ways. So how do you balance that in terms of making sure they are directing the resources they need right now in this time of need, but also you're asking them for those savings?
Andrew, I think your question was how are we balancing the needs to have people on the front lines doing the work that they need to do with this directive to start thinking about how we might have to make cuts. And the point that I'm making is that the state has limited resources. Even the CARES Act really doesn't extend much beyond, it doesn't extend beyond December 31st. And so it's important that we start building now for what we anticipate to see in the fall. And, that's the part of the discussion that I keep wanting to bring back, this notion of what the world is going to look like as we start to reemerge from the sort of crisis mode to a more stable mode. I've talked to EOG, I've talked to Devon, I've talked to little operators, I've talked to oil field service people, I've talked to coal mines, I've talked to bentonite mines, I've talked to many of the major industries that are supporting our economy. And they all anticipate being back at some date in the future, but they all anticipate that they're going to have to reduce their operations in the state. And because they're going to have to reduce their operations in the state, if you want to move an oil rig in or out, that is not a thing you just sort of flip a switch. The mobilization costs are sizable, bringing things back on, price volatility, a number of factors weigh into that. So our economy is going to be different. Our economy is going to be different from this day forward for a while. And we're going to do our best to make sure that our economy comes back, but don't look for that to happen in a couple of months. It's a year to a year and a half before we're going to start to see those kinds of activities come back. People aren't traveling. They're not flying the way they used to. That's a big demand on oil. And that, it's obvious that we're going to see, I was talking to Jared Polis, governor of Colorado today, comparing notes on what tourism looks like. He's saying he's going to have a 20 to 30% drop in tourism. Those are substantial numbers. And so when we come out of this period of crisis into a period of stabilization, it is important that people understand it's a different economy. We're going to have to address these needs in a different way. So with that, I want to thank you all. I'm sorry we're not in this room together. I'm looking forward to a day that we can do that. We want to see virus vaccines, that research going 100 miles an hour, talking to Governor Herbert of Utah and their efforts Governor Baker of Massachusetts and how they're trying to figure out ways that they can accelerate this. A vaccine would be a wonderful thing. A cure would be a wonderful thing. We're very anxious to see us all return. But in the meantime, people of Wyoming, you have done a phenomenal job. Continue to do a phenomenal job. Know that we're doing every single day, protecting your safety, doing everything that we can. Dr. Harrist has been an incredible voice of wisdom and advice in this moment. Director Schmidt has, her team and the director have just gone out of their way to meet the needs of Wyoming people. Director Cooley, who you've heard from before, has talked about how we're standing up the unemployment, making sure that works. Our friends and our colleagues in the legislature on a daily basis are calling and asking what are the things that they can do to be helpful. And I know it's got to be frustrating to be out there and feeling, how can I be helpful? What can we do? And so we are engaged with them across a broad spectrum. What are the things we can do to stand up more manufacturing? What are the things that we can do to stand up a lot of different businesses, new industries that are going to make a difference in Wyoming? You heard from Josh Durrell. And then at the same time, there's the standard bunch of business we have to do. What are we going to do on the Colorado River? What are we going to do on the Platte, the Goshen Irrigation District, the repairs we need to do on community colleges and other things? It's a very busy time, but people of Wyoming, we are working for you, and I can't imagine a better group of people to work for. God bless you, and God bless Wyoming. Thank you.